So far in this class, we've discussed almost all the benefits of cannabis and how it works. But because the ECS is such a masterful, widespread system, there can be some adverse physical effects of cannabis. As you learned, cannabis has a lot of potential to treat disease, and it's also resoundingly safe. So safe, it's commonly said that no human has ever died from smoking cannabis, at least not directly. And that's true. But while cannabis is highly unlikely to kill you, does that mean it's 100% safe? Well, let's explore some of the most common side effects of cannabis and also discuss some rare but serious negative effects that some people may experience. We'll start by discussing acute side effects. Acute side effects are those that occur from a single exposure or multiple exposures in a short time period. These effects are transient and wear off within 4 hours if we're talking about smoking, or 8 to 12 if edibles, maybe 24 at the most. Perhaps one of the most obvious acute side effects of THC is altered perception and capacity, aka being high. This can include changes in your short-term memory, changes in your sense of time passing, your sensory perceptions around things around you, or maybe taste, your attention span, your ability to problem solve or verbally communicate. THC can also slow down your reaction time, as well as motor control, coordination, and balance. Depending on the user's goals, some of these effects may not be considered adverse, but it is important that we consider them. Additionally, beyond those psychotropic effects, there's also a concern around heart rate. Consuming high THC cannabis definitely raises heart rate after use. To the average person, this could create only mild problems or not a problem at all. But in an unhealthy heart, this can increase the chance of a heart attack or stroke and must be kept in mind on our elderly patients or those with underlying conditions. Anxiety and paranoia. Feelings of anxiety or paranoia are not uncommon for THC. In fact, it's one of the most commonly reported side effects in new users. This is typically dose related, and if you're anxious, try taking a smaller dose or taking a dose of the product that's more balanced THC with CBD. Drowsiness is another commonly reported side effect of cannabis, and it's often also what people are using cannabis for, so it's no surprise. Drowsiness can be helpful unless, of course, it's the middle of the day and you have things to do, and in that case, you'll want to go ahead and avoid THC and lean into your balanced CBD to THC ratios. Another one of the most commonly reported side effects of cannabis is dry mouth and dry eyes, right? Cotton mouth, as it's often called. Due to the endocannabinoid system intrinsic connection with our tear and saliva production, these can be altered while taking THC. You can mitigate it by having a nice drink nearby or maybe having some hydrating eye drops. Allergic reactions to cannabis are not common, but is certainly possible. Cannabis plants make pollen and oils like other plants, and some people are just very sensitive. Sometimes this is a skin reaction related to handling or especially harvesting fresh cannabis. But it's also possible to become allergic to cannabis products that you're consuming by smoking or edibles. These allergic reactions can range from a rash to more serious issues like swelling of the throat. Individuals with other allergies are at an increased risk of cannabis-related allergies. Now let's explore the chronic effects of THC. And chronic means using cannabis regularly or over a long period of time. These chronic effects are typically only seen with the regular use of cannabis and don't really overlap with some of those acute effects. Lung problems are actually known to be associated with smoking marijuana. Smoking and vaping can irritate the lungs and cause a mild cough and inflammation, also called bronchitis. It can also increase phlegm production, or kind of mucus and spit, and is a slightly higher risk of lung infections for regular smokers. Fortunately, most data that we have does not suggest that cannabis increases your risk of lung cancer, despite the fact that there are known harmful byproducts in cannabis smoke. This lack of cancer risk associated with cannabis is likely related to the different effects of cannabinoids versus nicotine. Nicotine promotes cellular division, whereas THC inhibits cellular division. Another important thing to note is that cannabis users are statistically more likely to be cigarette smokers, and the combination of cigarettes and cannabis has been associated with lung cancer, but cannabis alone has not. Cannabinoid hyperemesis syndrome. This is a syndrome which I've seen personally as a pharmacist in the emergency department. It was previously thought to be extremely rare. However, evidence suggests that it's increasingly common in emergency departments and hospitals around the country. CHS, or cannabinoid hyperemesis, is almost always caused by long-term THC use, and it's characterized by extreme bouts of nausea and vomiting that can last many hours to even many days up to weeks. Many CHS patients, but not all of them, have their nausea relieved by taking long, hot baths and showers. Now, CHS is a syndrome that looks quite similar to another vomiting disorder, cyclic vomiting disorder, and it can be difficult for doctors to distinguish between them and also to treat. CHS does not respond well to most common anti-nausea medications, so always be transparent with your doctor about your cannabis use so that they can figure out what's causing your issues. One of the biggest concerns in the public is the effects of cannabis in the growing brain. The ECS is critical to our neurodevelopment as we age, and the introduction of smoking cannabis regularly does have an impact on neurodevelopment. The earlier we start using THC, the more significant the impacts. Effects are typically related to attention, learning, and emotional control. Users who start using before the age of 14 are more likely to struggle with anxiety, depression, and ADHD. Another commonly raised point around THC is addiction. And while THC is not highly addictive, it is important to recognize it does have the potential to be addictive. Because THC causes a secondary release of dopamine in the part of the brain known as the rewards pathway, it does have the potential to create an addictive relationship. Addiction to cannabis is also known as cannabis use disorder, and it occurs on a continuum. Basically, the body becomes dependent on cannabis, requiring more to feel normal, and when cannabis is stopped, there can be a withdrawal. This withdrawal is characterized primarily by mood swings, changes in appetite, anxiety, and an inability to sleep. Of course, compared to withdrawal from many other drugs, like alcohol and benzodiazepines, which can result in death, these are of course very mild withdrawal symptoms. However, it is good to be aware of them. Another concern around the safety of cannabinoids have to do with the reproductive effects. As you learned in previous modules, the endocannabinoid system is important all around the body, including in both the male and female reproductive systems. The chronic smoking of cannabis has been related to reduced fertility, especially in men, and can have negative effects on a fetus inside of a pregnant mother. At this time, the true nature and extent of these effects are still mostly unknown. One other thing to note is that during breastfeeding, mothers should avoid using cannabis as it is excreted through the breast milk to the baby. One caveat to this entire lecture, it's worth noting that the research related to cannabis and the adverse effects has received magnitudes more funding than the benefits of herbal cannabis. The vast majority of long-term concerns around cannabis use stem from THC exposure, and there's very little evidence that long-term use of CBD, CBG, or really any other cannabinoid carries the same risks that have been discussed in this lecture. Cannabis isn't perfect, it's a useful herb that comes with some common side effects, and you can empower your patients to avoid them.